Good afternoon, everyone, and thank you for joining us at the Fund for Women and Girls for our final in this session's Blueprint Lunch Series. Today, we have an incredible panel of guests who are going to speak to us about the issues and disparities that women of color, maternal birthing women of color, face in our county and beyond. So excited to introduce you to everyone. We have a very exciting session planned for today, with our title being Empowering Voices, Addressing Disparities in Maternal Health for Women and Birthing People of Color through Advocacy and Action. Today, we're going to start with an overview of our Blueprint report and how it relates to this topic. And then we're going to hear from our incredible speakers, and we're going to hear more about what we can do moving forward, as well as answer any questions you may have. If you notice at the top of your screen, you have the Q&A button, or maybe on the bottom. You can enter in at any point any questions or comments you may have. And throughout the presentation, I will share that information and get responses for you. Now I'd like to turn it over to the Fund's Executive Director, Kim Andrews, for an update on the Blueprint report.
Hey, everybody. I am so glad that you're here with us. The reason we're here talking about Black maternal and infant health, it makes me angry that we have to keep talking about it and addressing it, but it's so very important, and I'm grateful to be here, and I'm glad you're here, and I'm so glad that all of our guests are here to speak about this, people who are working to make things better in this county. The Fund for Women and Girls, our mission is to lead and unite the community through philanthropy and advocacy to ensure that women and girls have resources and opportunities to thrive. We had our 4th edition Blueprint. Our Blueprint is a deep dive research report on the state of women and girls in Chester County. In September, 2 Septembers ago, we released the 4th edition, and we realized that it lacked disaggregated data about the challenges of women and girls of color here in Chester County. So we are right now launching a task force made up primarily of women of color to put together a gender and racial equity special report, which will be a supplement to the Blueprint. But today we're here to talk about Black women, women of color, and infant maternal health disparities and the systemic racism and bias that results in worse outcomes for Black moms and their babies here in Chester County, and to start to work towards change. We had some alarming key findings from our 4th edition Blueprint report that showed disproportionately dangerous health outcomes for Black mothers and infants in Chester County. Prenatal care is the health care that a woman receives while she's pregnant. Women who don't receive prenatal care are 3 times more likely to have a low birth weight baby and 5 times more likely to die than women who do get prenatal care. Black women in Chester County receive prenatal care at a much lower rate than women of other races, but care rates have improved from 2012, when only 50.6% of Black women received prenatal care. So we've had some progress at a local level, and we need to keep moving that forward. Chester County has a lower rate of low birth weight babies than the rest of Pennsylvania and the US, but Black babies that are a much greater risk than babies of other races. In Pennsylvania, our research showed that Black women are 2.5 times more likely to experience infant death than women of other races, which is just a heartbreaking statistic that should make all of us not just pay attention, but act and do something to make things better. And that's what we're trying to do. And you'll hear what our guests are doing, and then what the fund is doing and what you can do. There was a recent study from California by the National Bureau of Economic Research that found that the wealthiest Black women had worse childbirth outcomes than the poorest white women on average, which is an indication that Black mothers and their newborns suffer harm before childbirth, regardless of socioeconomic status. So this gap in infant and maternal health is not just explained by differences in economic circumstances, but we really need to think about how that gap is much more structural, and it isn't about biology. It's about level of care and cultural competence of that care. So I would like to introduce Cheryl Miles, who's coming up next. Cheryl is a founder and leader of the Black Women of Chester County in Action. She's a fund board member. We are so fortunate to have her on our board, and I'm so lucky to work with her. And she is a longtime nonprofit service provider who can speak really deeply to this issue. So Cheryl, welcome, and thank you so much for being here, and thank you for everything that you do for us here in the county.
Thank you. Black women of Chester County in Action. A vision is that every Black woman and girl in the county is living their best lives. Our mission is to positively impact the economic well-being and health of Black women and girls in Chester County, Pennsylvania, through education, advocacy, and leadership. We are formed in response to the negative outcomes disproportionately impacting Black females' well-being of all ages in Chester County, as reported in the Funds for Women and Girls 2016 Blueprint Report. We refuse to believe that Black families, especially Black females, who are less than 6% of the county's population, should fare so poorly in one of the richest counties in the state. We also recognize that the root of the disparities was and is racism and discrimination. Our primary goal in the next 3 years will be to focus on increasing the awareness of the impact of racial trauma in our communities, as well as promoting resiliency and recovery while within the Black community. We also will be educating the community regarding the importance and power of voters' engagement to bring about systematic change. We became partners with Maternal, Child, and Health Consortium about 2 years ago when we learned about the PPOR Spirit Project. And this was about the time we were coming out of the COVID quarantine. We've known about the funds report we've known about the funds report that Black women were 3 times more likely to die from pregnancy-related causes than Black women, and that Black infants were more than 3 times likely to die of low-rate complications and than non-Black infants. Multiple factors contribute to these disparities, such as quality health care, underlying chronic conditions, structural racism, and implicit bias. We felt that we needed to be a part of this project to ensure that the Black community, especially Black women in the birthing ages, are included in MCHC's fact-finding data in Chester County, and were seated at the table for decision-making and policy-making to definitely bring about systemic change. We believe that it's a women's issue, it's a healthcare issue, and it's a community issue. The goal of our partnership is to help to elevate these issues to all stakeholders in our community so that they can find their role in reducing the mortality rate in birthing mothers and infants in Chester County, and also to hold them accountable. We, BWCCA, desires that every birthing mother be able to safely raise their children into adulthood. Why? Because the lives of our next generation, Black men and women, depend on it. Thank you for your time.
Thank you so much, Cheryl. This time I'd like to introduce Alma from the Maternal Child Health Consortium, and she's going to speak to us about the Perinatal Periods of Risk project that they are currently working on. Welcome, Alma.
Thank you, Blake. Good afternoon. I am Alma Vidal. I am the Director of the Healthy Start and Family Benefits Programs at the Maternal and Child Health Consortium. At MCHC, we serve all families and children in Chester County and parts of Montgomery County, especially in Norristown and Pottstown. Our vision is to advocate for and empower prenatal parenting families to achieve healthy beginnings and bright futures through a caring culture of services. So today, I will talk to you about our Perinatal Periods of Risk, or best known as PPOR project. Next slide, please. So what is PPOR? So PPOR is an analytical framework for studying fetal and infant mortality in a specific community. In this case, we are focusing on Chester County and Norristown and Pottstown, as that's the specific community that our Healthy Start program serves. It originated with the World Health Organization, and it has been modified by CityMatch along with the CDC, HRSA, and March of Dimes. It focuses on a community's racial disparities in fetal and infant mortality rates. PPOR helps communities to identify and prevent risk factors during the greatest periods of risk. So in this graphic, you will be able to see the infant mortality rates by race and ethnicity. This data is from 2017 to 2019, and you can see the big gap. We're gonna focus mainly on Black and white infants for this comparison. So you can see with the Black infants, it's 11.0, and white infants is 4.5. So there is a big difference right there. Next slide, please. So these other pictures can show you a little bit. These are the 4 perinatal periods of risk that we study with our research. So I can give you some examples. The maternal health prematurity is the blue box. So that is for fetal death with 500 to 1499 grams weight. And then we have the pink box, which is fetal death with 1500 grams of weight. And then we have death after 16 days of birth. And that will be between 500 to 1499 grams weight. That will be based on the blue box again. And then death after 45 days, but less than 365 days, and over 1500 grams of weight, that will be on the green box. Next slide, please. And then based on these perinatal periods of risk, we have the 4 categories right here. And these are some of the risks that each perinatal period focuses on. So preconception health, perinatal care, maternal behaviors, that will be for maternal health. And then maternal care, it will be prenatal care, obstetric care, social determinants of health. And then we have the newborn care, which is neonatal care, pediatric surgery, perinatal management. And then we have the infant death, which includes sleep position, breastfeeding, injury prevention. So our project follows the collective impact model, and it counts with different stakeholders from different backgrounds, work backgrounds. So as you can see, our group is called a Strategic Partnership Initiative to Reduce Infant Mortality Trend, or SPIRIT. And we have people from different backgrounds participating, as it is a collective impact that we want to make in our community. So we have people from community clinics, health systems, academia, community resources, prenatal support, and I will say that the most important of all of us is the lived experience experts. Next slide, please. So when we talk about data collection, there were different areas in which we focused to get more findings. So our evaluator, Dr. Victor Alice, was able to study the infant mortality data from the Pennsylvania Department of Health. And this data set was from 2013 to 2019. And then we also conducted focus groups with women in Chester County to capture their perceptions of racial gaps in infant mortality. And then we also conducted one-on-one interviews with Chester County women that were currently pregnant, recently pregnant, or that they were pregnant, experienced any pregnancy. Then with the phase 1, we analyzed the infant mortality rates. And so again, is the box that I showed you at the beginning with a few examples. And as you can see, the blue box and the pink box are the ones that have the higher gaps right here between, again, African American and Black babies and white babies. So maternal health and prematurely, they have a big gap with 9.03 for African American babies and 2.44 for white babies. And then if we look at the pink box, again, there's a big difference right here with 8.13 for African American babies or Black babies, and 1.7 for white babies. So it is a huge gap between these two races. And as you can see in the following 2 boxes, we still have some differences, again, affecting more Black and African American babies. So the phase 2 analysis is the associated risk factors that I will share with you. And some of these include, and it's focusing on Chester County risk factors for infant mortality. So it will be previous cesarean, previous preterm birth. Again, you can see the big gap right there between white and black babies, and then eclampsia, and the list goes on and on and on. And you can see it's always the Black and African American babies that are higher risk. So based on the interviews that we conducted with participants one-on-one, here are some of the quotes that they share with us. I think it's very important for us to hear what they have to say. Some of them are, I was more comfortable after switching a provider, able to see me more often than my previous provider. I felt I had no choice but to travel for better services during my pregnancy. I constantly had to repeat my concerns to my provider. My symptoms were not being taken seriously. I was stressed trying to find mental health resources in my community. And these are some of the summary findings. So again, from the perinatal interviews that we conducted one-on-one, is the lack of awareness of resources in the community. So many times they don't know what's available for them. Limited prenatal and behavioral health services. Again, many times they have to travel outside of their cities where they live because there's not prenatal care available or behavioral health nearby. And we know that limited transportation in Chester County, it's a big issue, especially for pregnant moms that have to get to and from medical appointments. And then pregnancy concerns not being able to be taken seriously by providers. So participants feeling like their concerns just were not being listened. And then community challenges that involve racial disparities and infant mortality, where mistrust in the health system from systematic racism, closure of the Brandywine and Jennersville Hospital, Chespin Health Services no longer providing prenatal care, LCH Health and Community Services not taking new prenatal patients at the time, and identifying Black birthing people. So meeting communities where they are. So these following 12 points are some evidence-based suggestions from Dr. Michael Luce, and to reduce Black and infant mortality, the Black and infant mortality gap. So we actually, as a group with the Spirit stakeholders, we picked 5 points to focus on as we were coming up with our community action plan. And they include improve the quality of prenatal care, expand healthcare access over the life course, reduce the poverty among African American families, support working mothers and families, and undo racism. We know that these points are all doable, but we also know that it takes time and it takes effort and it takes a whole community to be able to achieve them. And then, as I mentioned before, we choose and selected these 5 points to go based on our community action plan. So some of the goals that we came up with to be able to improve birth outcomes are cultivate relationships and trust among African American families, support and advocate for the mental well-being of birthing people and their partners, educate birthing people how to advocate for themselves during the perinatal period, support diversity in the healthcare workforce, and enhance coordination of health and social services. And our objectives and things that we would like to see in the upcoming years is to provide scholarships to community members wanting to become certified doulas, implement a pilot community-based doula program for Chester County birthing people, hold peer support groups for the birthing people and their partners, host community engagement events to support Black families of Chester County, and hold quarterly maternal child health committee meetings in Chester County. And then where we are now. So we have been working with many of the stakeholders, and in collaboration with OIC, we will be hosting a financial literacy first-time home buying educational workshop for people in the community. We attended many community health education and awareness events We also attended different culture events, like the First Friday in Coatesville, Family Fun Day, and Racism and Black Maternal Health, Infant Health Conference. And the purpose of attending these events is to educate the community and stakeholders, but more than anything, make them aware of what's going on and the importance of supporting projects like this in their community. We also are launching different support groups for participants in our community. We were able to complete the first support group, which was a vision board experience for participants in the community. And coming up, we will have a lactation support group and many others. And then we are also researching different doula programs like the Amor, Health Connect One. We want to make sure that if we are able to implement a doula program, is based on the needs of this community. We want to make sure that we have, that we are able to find out what's best for Chester County. We also, in collaboration with Once Upon a Preemie, we were able to provide a training to reduce implicit bias in the health system and community health services. So how can we work together? We can, if you're interested in learning more about this project, please, reach out. Attend our meetings with stakeholders so you can learn more about what's going on. Spread the word about the project. Talk to your friends, talk to your participants about it. Reach out to see how you can become part of this initiative. Thank you so much for your time.
Thank you, Alma. And just a reminder to folks who are viewing, you can always put questions or comments in the Q&A section. And at this time, I'd like to welcome Talonda Rogers of the 4th Trimester MAHMEE.
Hi, thank you. So my pregnancy started out as normal, but in the end, it was anything but. I was always a scheduled C-section due on November 10th of 2000. So let's look at the chain of events that happened in my situation. In early October, I began to have contractions. And I would start contracting somewhere in the evening time. I went to the hospital. I would get settled in on the maternity unit, and they would monitor me all night and release me in the morning. This happened every night for 1 week straight. Finally, I was admitted to the hospital on the 5th night straight of me going back and forth to the hospital. They hooked me up to an IV of magnesium sulfate, and I was told that it was going to stop my contractions, which it did. It was too early to have the baby yet. When I was released, I was discharged on bed rest with home visiting nurses 3 times a week and 2 medications I was supposed to take around the clock every 6 hours, which I did. As my pregnancy progressed, next slide, please. My visiting nurse, it was a Friday afternoon, I remember, she found protein and sugar in my urine. Since she was on her way out for the day, she told me to call my doctor. She was sure that they would get me in to see me right away. When I called, I was told that my doctor was on vacation. And since they were on vacation, I would have to see someone else in the practice. And I have an appointment coming up on Tuesday anyway, so they would see me then. So Tuesday came. At that appointment, I did see another doctor. I was told that they did not find any protein or sugar in my urine. So we pretty much wrapped up that appointment with orders to stay on bed rest, continue with my medication. Next slide. The pregnancy progressed and I developed blurred vision. I could barely see the hand in front of my face. That was about as far as I could see. I remember telling my doctor at my appointment, asking her, has anyone ever complained of blurred vision? And I'm also drinking so much water. I'm so thirsty. I have an unquenchable thirst. My throat feels like sandpaper. In fact, my sisters are making fun of me, wondering why I have so much water on my counter and I'm drinking so much water. And to which she responded, no, nobody's ever complained of those things. Are you continuing to take your medication and are you staying on bed rest? To which I said, yes. So this being my first pregnancy, I thought it was all normal. And I went home to continue my bed rest. And so fast forward, we are at the week that I was due. November 10th was a Friday. I remember on a Tuesday, November 7th, I don't think I felt my baby moving much that day. So I called my doctor. I said, my baby's not moving. Okay, Talonda, we will see you tomorrow. We have a cancellation, which would have been Wednesday. On Wednesday, I went into that appointment, and back in the exam room, my doctor was kind of fiddling around with her Doppler because she couldn't hear a baby's heartbeat. So she asked the nurse, she said, "Is this my favorite Doppler? Bring me my favorite Doppler." So the nurse left the room and brought back a Doppler. The doctor put it on my belly and she heard a heartbeat. And we pretty much wrapped up that appointment with small talk about how excited I must be. Friday was a big day. And so I went home and I couldn't wait until Friday. Next slide. And so November 10th was the best day of my life. This was my first pregnancy. I couldn't wait to meet my child. I had waited to find out the sex of my baby because I wanted to be surprised. Next slide. At the hospital, I was getting settled in and my nurse was hooking up to the baby monitoring equipment, and she went out the room and she brought in another nurse. And that nurse went out the room and she brought in another nurse. This happened 3 times. And finally, they brought in what I still refer to as a medieval looking machine. It had 2 large paddles on it, one for either side of my belly, which they placed on me, and they jolted my belly. My baby didn't move. They jolted me again, no movement. So I began to become hysterical, basically knowing something is wrong. So between my husband and the nurse, they were able to finally get me calmed down enough. My nurse did tell me that, "Don't worry, honey, sometimes babies are just asleep." So we waited. Next slide. I was an 11:30 scheduled C-section, so we waited around for a little while until that time. Next slide. The anesthesiologist came in at 11 o'clock to get my consent for the surgery, and at 11:30 sharp, I was wheeled into the OR. Upon receiving my spinal anesthesia, I was laid back so quickly that the anesthesia not only went down to paralyze my lower body, but it went up and paralyzed my lungs. I couldn't breathe. Over top of the hustle and bustle in the OR, I was finally able to get the attention of my anesthesiologist. I was saying, "I can't breathe. I can't breathe." And finally, he assured me that I was breathing fine according to his monitors, and he placed oxygen on me. At that point, I knew I was going to die. So I closed my eyes and waited for death. Eventually, that feeling did subside, and I was able to breathe easier. After lots of pressure, pulling and tugging and pressure, which seemed like forever, the baby was out, and I heard complete silence, except for the sound of CPR being performed. I knew in my heart what the outcome was. No one said a word, not a nurse, not a doctor, anyone. I knew what the outcome was, and I repeatedly asked to see my baby. I want to see my baby. Where is my baby? Eventually, the anesthesiologist looked down above my head and assured me that my doctor would speak to me back in my room. Back in my room, my family was already waiting, along with my doctor, my nurse, and the hospital chaplain. My nurse stepped forward, sat beside me on my bed, and delivered the worst news of my life, and that's that my firstborn had been stillborn, a full-term stillborn. I was encouraged to hold him, to gain closure, to name him, and to say my goodbyes. So I did get to hold him, and my family got to hold him, and so forth. Next slide. This was the worst day of my life. I never expected that I would have empty arms and leave that hospital without a baby. Next slide. Not only did my child die, but I almost died as well with a blood sugar of over 750. I also developed a paralytic ileus, and I needed an NG tube. That's a tube that goes in through your nose, down your throat, and into your belly to drain the bile and everything that's in there that's making you sick. And I was very sick, staying in the hospital for 8 days. I had to plan my son's funeral at my bedside with the funeral director. Next slide. And when I was released from the hospital, I was able to bury my child in the next couple of days. Next slide. So I became a nurse to help people heal, and a nurse educator to help graduate culturally competent, compassionate nurses. I became a business owner to help bridge the communication gaps between patients and providers. And I wrote my first book dedicated to my nursing students in hopes that what I learned may help make their lives easier. In the United States, we have the worst maternal mortality rates of all developed nations. And I don't understand that, because people come to our country every single day for life-saving surgeries, but in this one area, we are failing. Next slide. And although all women are dying, as you can see, on a whole, Black women are dying at 3 to 4 times the rate of all others. And the people who fall into the near miss category, such as myself, are much greater. Next slide. Just a year ago, the statistics said that 60% of these deaths were deemed due to preventable causes, as you can see in my chain of events. As of this year, the results are that 84% of the deaths that are happening are preventable. And according to the statistics, most of those deaths are happening in the postpartum period, anywhere between 7 days postpartum to 1 year out. And the statistics also say it's mostly because women are not being listened to and they're not being heard. Next slide. So I'm creating the 4th trimester MAHMEE, Maternal Advocates Helping Magnify Education and Empowerment. Next slide. It is our mission to educate and to empower women and their families, to be a liaison for them, and to provide direct support to those who are most vulnerable in order to work to change the narrative to deliver the best care possible. It's our vision that no mother will die ever again due to preventable causes. Next slide. At the 4th trimester, we are offering a plethora of services, from mental health one-on-one support to yoga classes to strengthen the heart muscle, therapeutic massage for fluid release. We're offering moms a rest, which we know they need desperately. Next slide. We're offering lactation supports and just being that advocate and that liaison for women that they need to keep close eyes on them in the 4th trimester through a maternal clinic, really a blood pressure clinic. And we say that we are focusing on mom care, not just healthcare, but mom care. And so we're not only going to educate moms and their families, but also healthcare providers. Next slide. So how can you help? We would like you to partner with us. We need to know if there are any healthcare providers out there. We want your referrals. We want your referrals of who needs extra eyes on them in the 4th trimester, who has a mental health history or barriers to care, who suffered loss, who just needs that extra education. We want to be that liaison for you in the 4th trimester. We want to also conduct in-house training and large group presentations. Next slide. So you can make a donation to our nonprofit, which would include taking care of any of these personal care supplies that women desperately need, but also childcare fees, which is much needed, ride sharing costs, co-pays for mental health supports, and any of the services that you see at the 4th trimester. Next slide. And this is how you can reach us. Thank you very much.
Thank you so much. And at this time, I'd like to introduce Portia, Nichelle, who's going to speak to us about her experience and the work that she's doing. Welcome.
Hi, good afternoon. My name is Portia Nichelle, and I am truly honored to introduce Covenant Lives Healing Heart Agency, our nonprofit organization that was formed in 2021 right here in Chester County. You can go to the next slide. So Covenant Lives Healing Heart, the one prior, Covenant Lives Healing Heart Agency was formed out of my own lived experience and the need for our family to find a resource and a way to forge our own pathway forward in the resilience in the aftermath of pregnancy and infant loss. You can go to the slide before.
I apologize, I'm working on it.
That's fine, no problem. So I gave birth to my son, Desmond. He was stillborn April 7th, 2017 at the Chester County Hospital. This is also a hospital where I delivered 2 of my other children prior. What was different about this pregnancy was when I found out I was pregnant with Desmond, I was already 6 months into my pregnancy. And there was a few factors that prevented me from even knowing that I was pregnant. During each pregnancy that I've experienced previously, I would get gestational diabetes. So I knew that needed to be treated. I also have, my blood type is O negative, and I was RH negative in my pregnancies, and I'm always due to get the RhoGAM shot in my pregnancy. So when I assumed I was pregnant, I was getting pregnancy tests, and they were coming back negative for about 4 months. This went from the month of July all the way up until the month of October. I was getting negative results for pregnancy. So I thought that the issues that I were having in my stomach was a lot of gas and being constipated. So when I went to the hospital this is right after Christmas in December, I was still having these issues. And at that time, the triage nurse had asked me, did I think that I was pregnant? And I said no, because I had tested negative previously. And they said, well, we're going to go ahead and take a urine and a blood test at that time. And that was the first time that anyone had mentioned that they were going to do an extensive test to that nature. So when the test results came back, the first the urine came back positive, and I was in disbelief because I had negative results. When the first blood test came back positive, I was still in disbelief. And at this time, I'm pretty much telling the doctors, like, hey, there may be something else going on, hormonal, that may be having a positive read, but I'm pretty sure I'm not pregnant. So the second and third blood test came back positive. At this time, they ordered an ultrasound. I go in for the ultrasound, and lo and behold, there was a full baby in my stomach. And what I thought and assumed to be gas at the time was actually him kicking. I started my prenatal treatments at the Chester County Obstetrics Clinic, also with the maternal fetal medicine because of the diabetes. And during this time at the hospital, this is back in 2017, they were in transition. There was a lot going on at the time. My doctor, even at the maternal fetal medicine, she was also pregnant and in her third trimester. And she was out a lot. So within the 4 months in which I had remaining, I would probably only seen her about 2 times. And it was still winter time. So travel, snow, all of that was going on. But nonetheless, the visit that is in question, at the time when I started to realize something may be wrong, not my first visit, but one of my visits at maternal fetal medicine on April the 4th. April the 4th, I went in. It was a normal appointment. We're doing the Doppler read. And at the time, the nurse starts to notice that, she's using a Doppler. She's pushing on it. She's reading it, and something's wrong, but no one's telling me like really what's happening. So whatever she saw, she said, hey, Portia, I think I'm going to send you across the street to the hospital, get evaluated. So I walk over across the street to the hospital, and I'm put in a room. At the time, I'm on the belt. They're reading my heart rate. They're reading the baby's movement. I'm on the belt for about an hour, and the nurse comes in. She's reading, and whatever she saw, she noticed something, but again, not communicating with me. She says to the doctor when he came in to review, what do you want to do? And he said to her, mind you, in my presence, he said, we're really busy tonight, and let's just see what we can do. He comes over to my stomach, pushes it a few times, and the baby rolled. I felt the baby roll at that time. And he says, did you feel that? I said, yes. He's like, well, if anything changes, he said, come back. So I'm sitting there, and I'm just like, well, what am I supposed to change? Because everything up until this point has been normal. So I'm trusting the doctor. I go home. That was on a Tuesday. Wednesday, I cook a big meal for my family. Everything as normal. Thursday came and went. Friday, I go back in for my next appointment. And I'm in the room at maternal fetal medicine. The nurse comes, she puts the Doppler on my stomach. And this time, she rushes me to the table, does an ultrasound. The next thing I know, I'm being walked across the street by a nurse. On our walk, she's not saying anything to me. I don't know what's going on. We get into the room upstairs in labor and delivery, and that's when she lets me know that that unfortunately my baby had passed away. So I'm taken back downstairs into a maintenance-like closet that had just a bed in there. A doctor comes in. I'm assuming it was a doctor who comes in with an ultrasound machine, and he does an ultrasound, and he says for me to look at the monitor, and he replies and says, "Do you see that there's no heartbeat?" That was at 10 o'clock in the morning. I had to wait until 6 or 7 o'clock p.m. To get for anesthesia to be able to deliver my son stillborn. My time at the hospital and what I experienced bedside manner was just very unwelcoming, right? I didn't know what was going on. I was confused and numb to what was happening at the time. And because I had a scheduled C-section, there was no sense of urgency to make me aware of the process that was going on. So I just had to wait my time out. I was glad that you can see in these photos represented here of that evening was my family, my other children who at the time, my oldest was on a college tour. My daughter, she was a freshman in high school, and my youngest son at the time was in 4th grade. This was alarming for our family, a lot to digest and just comprehend at the time. After the delivery, up until this day, I continue to say there's yet to be someone to reach out to just ask how I was doing, to ask if there was anything that I needed. And even trying to attempt to get medical records to find out if there was anything that could be done afterwards was very hard and difficult. And this was just something that we just had to deal with pretty much. You can go to the next slide at this time. So from my experience, Covenant Lives Healing Heart Agency was birthed out of the need of my family. Like I said, just to find a way to move forward. You can go to the next slide. So our mission is simple yet profound, to be a beacon of light and support for families enduring the heartache of pregnancy and infant loss. We provide a sanctuary of resources, advocacy, and programs aimed at nurturing healing and growth in the midst of despair. You can go to the next slide. The purpose of our agency is deeply rooted in compassion and understanding. We aim not to just provide support, but to empower families on their healing journey. Our holistic approach focuses on addressing emotional, mental, and physical well-being through programs and alternative healing practices. You can go to the next slide. What sets Covenant Lives apart is our commitment to innovative solutions. We are excited to unveil 2 groundbreaking initiatives. On these next 2 slides, you will see the data and stats that support why our organization exists and why we'll continue to partner with other community organizations that in efforts like the ones presented here today are working on the front end to prevent maternal infant mortality. Our organization will stand in the gap of those families who fall in between the cracks, who have the unfavorable outcomes and are looking for a pathway forward in the aftermath of loss. You can go to the next slide. And you go to the next slide. So just like the services that we provide, we're excited to unveil 2 groundbreaking initiatives that our organizations are working on. One is an 8-week program that harnesses grief as the catalyst for personal growth and emotional wellness. This program integrates holistic practices that empower individuals to transform their pain into opportunities for personal development. And we're also developing a specialized training program for professionals who serve these families. And our goal in that is to equip healthcare providers, counselors, educators, and support staff with the tools and sensitivity needed to navigate this delicate terrain with empathy and expertise. You can go to the next slide. And those are our initiatives. So with our initiatives, and we talk about the holistic approach, we are partnered with the Testimony Project. And part of the programs that we work on together are programs that allow our clients and our audience to work with moving forward in those initiatives through expression, a lot of art expression, things that are therapeutic that allow us to sit down and have conversations in a healthy and growth mindset. Here are the pictures that you see listed. Here are some of the initiatives that we've worked on with families as far as making jewelry. The children in the programs, they make jewelry bracelets that represent the growth, the grief, and the love that are shared between the families going through these experiences. Also, we have some ceramic and clay art that we also make that are memories and memorabilia for families to always keep in remembrance and honor the infinite love of their baby gone too soon. You can go to the next slide. And ways that that you can help. So when we talk about, as we're growing as an organization, we are now looking forward to putting together a strong board that is compassionate about our causes. So we need people who are passionate like you, even for political stakeholders that may be present, whether it's at the local, state, or federal level. Your influence in policymaking is immense, and your guidance will help enable us to advocate effectively for policies that prioritize the needs of our bereaved families and ensure that they have access to essential support services. Continuing to collaborate with community organizers and organizations, your expertise in engaging communities and mobilizing resources is invaluable, and your insights will help us to strengthen our community outreach and ensure that our programs effectively reach those who are in need. So Covenant Lives Healing Heart Agency is dedicated to fostering a diverse and inclusive board that represents the voices of our community. And we warmly invite you to participate, whether it's a volunteer, whether you offer your skills, your resources, or your network. We ask you to be a part. You can go to the next slide. So we also, in ending, we also partnered with the Star Legacy Foundation that provides us a lot of material that we use within our programs. And also we're looking to also include them in opening a chapter right here in Chester County to help with their efforts with the Pregnancy Research Project as we continue on gathering data and statistics geared specifically to our audience. You can reach out and follow us on Covenant Lives to stay updated with what we have going on in our programs. And also, you can, if you are interested in partnering or providing any resources to us, you can also reach out to us at covenantlivesllc@gmail.com. Thank you.
Thank you so much, Portia. And I want to thank all of our guest speakers. We will certainly keep the Q&A open and have some time for that. We would like to take a brief moment before we move on to acknowledge and apologize. It was my mistake. We should have absolutely given a trigger warning, given that there was frank discussion about infant loss. It's a very hard topic, and I acknowledge that, and I do apologize for neglecting to do that. Just wanted to take a moment to do that, and now turn it over to Kim for an update on what the fund is doing about these issues.
Hi, everybody. Before I talk about what the fund is doing, I just want to reiterate what Portia and Talonda and Cheryl and Alma all said about what we can do to help them in their work. The fund is here to help other organizations, and you heard the Black Women of Chester County in Action is working on these issues. MCHC is working on this, and then hearing just the dismaying data and statistics, and then these very difficult stories that are the personal lived experience of Talonda and Portia, and what action they're taking to make sure that this doesn't happen to other people. What can we all do to take action so that change can be made here in Chester County and in prenatal care, postnatal care, birthing care. So please, we're going to put in our slide, we're going to send out an email afterwards so that you'll all have contact information for Talonda and Portia, as well as the information about the 4th trimester MAHMEE and Covenant Lives Healing Hearts Agency, so you all can look to support that. We at the fund, we are looking forward to working with them going forward. And the women like this are the ones who are making things happen here in Chester County. So much of the work to advance women and girls starts at a very grassroots level. Large nonprofits start from small nonprofits that realize there's a gap in care, a gap in service. And that's what I see Talonda and Portia doing, is they personally experienced that gap in probably the worst way possible, and they are looking to take action to fill that gap for other women ahead of them. So at the fund, we do grant making and advocacy. So we have been looking at legislation in the State House mostly, and the State Senate. There was recently Senate Bill 262, which was passed to review severe maternal morbidity rates, to make sure that the state health agencies are clocking that and making sure they're understanding what is happening for maternity and disaggregating that so we understand for women of color. Representative Schwank from Berks County, and then Morgan Cephas, who that was my neighborhood that I used to work in, from Philadelphia. They sponsored those bills in the House and Senate. Here in Chester County, Katie Muth, Amanda Capoletti, and John Kane supported the bill as well. And in really exciting news in the state of Pennsylvania, there's been a women's health caucus for a long time, and the fund engages with that. On October 17th, Morgan Cephas was one of the founders of a new Black Maternal Health Caucus that is going to be keeping its eyes on advancing legislation to address the issues and the statistics and the experiences that we heard about here today. There was some previous legislation that didn't move forward around Medicaid coverage for pregnancy-related and postpartum medical assistance, Medicaid coverage for doulas, and implicit bias training to create that cultural competency, so that the gap in care that so many Black women experience in birth can start to be filled a little bit. So these bills didn't move along, but we're going to be working with their sponsors to see if they can be reintroduced. Next slide, please. And then what we're going to do is we're going to support the 4th trimester MAHMEE. We're going to support Covenant Lives Healing Hearts Agency, Black Women in Chester County, MCHC. That's what we do, grant making and advocacy. The Pennsylvania Doula Commission is overseeing and looking to expand doula care in Pennsylvania. And I know we want to make sure that we as an organization, we elevate the work of that Pennsylvania Black Maternal Health Caucus in the House. We're going to actively participate with the Perinatal Periods of Risk project in Chester County. And one of the exciting projects there is to put a pilot program together to train Black doulas in Chester County so that there's a Black birth attendant in the room with Black birthing people, and that cultural competency gap can be closed a bit. And then as I said, we're going to advocate for legislation that will address these issues and engage our legislators on them. And we're going to open it for questions, but I just want to personally say again, thank you to Talonda and Portia for sharing your personal lived experience, and then engaging your professional experience and knowledge for the work that you're doing now. Thank you.
And I want to echo those sentiments as well. And thank you to Cheryl, and thank you to Alma for joining us and providing such a well-rounded program that really looks at from start to finish the issues that women face in Chester County and beyond. So yes, please enter any questions in the Q&A. It's not a question, it's a statement, and it's really sweet. We love familial support here. So Robert Rogers is so proud of Talonda. He typed in the chat, it's very sweet. Ask any other questions. Here's one question. Oh, somebody's typing, okay. And any of our panelists can answer this. Any specific challenges within healthcare institutions that need to be addressed? We've certainly heard some of that spoken to, but if anybody would like to jump in with specific things, whether it's experienced or seen in data that the healthcare industry can directly address.
Hi, this is Portia. I definitely want to, and Talonda mentioned it earlier in her presentation, but it is the fact of listening to the individual who's having an experience during their pregnancy, if there's any concerns, and really giving attention to that. Like she said, that is a big part of the preventable causes that could be stopped right there. Even in my own personal experience, had the doctor listened to me and my concerns, it may have been looked into a little more, and we've been able to identify that there was a deeper issue going on inside versus just saying we'll take care of it on the next visit.
I would also like to say thank you for that, Portia, and agree wholeheartedly. And it says that in the statistics and the research as well, that is a key factor. But training needs to be more than just something we check off as a to-do once a year, twice a year. I was actually at a hospital recently and I asked, well, what are your training? What's that look like? And the nursing supervisor told me twice a year. Well, we know there are high turnover rates, and in a world where there's already a nursing shortage, and if you have high turnover, with the regular nurses who have been there a while, twice a year is not nearly enough. Not nearly enough. We need to constantly be in training, in learning, and like I said, more than just a checkoff box, but really be engaged in how do we make our facilities better, and how do we come alongside, older nurses and new nurses and hospital staff. Everyone needs constant education.
I think to add to that, I definitely agree, and Portia beat me to it about listening to the mothers in front of you, to be able to really take seriously their concerns. Because I think the other thing that people don't recognize is that there's not a lot of research from the Black community, and a lot of our symptoms or things that we experience don't necessarily resemble that of other cultures. So there are things that, because you're not listening, you're not hearing, and you're missing particular things that we are experiencing, so it's not being addressed. I think the other thing I agree with Talonda is on the training. Training is so key to people understanding the folks, the professionals understanding the folks that they serve. But if you're not doing any check-in to see if that training is actually working, then what's the point? The healthcare systems kind of, just doing the basic providing of services, or are they really developing that relationship? Relationships make the difference in a successful, successful isn't a word, but the relationship, a really positive experience, however, whatever the outcome is. So if the provider, if the hospital, if the clinics don't have a relationship with the people that they serve, then that's a missed opportunity to provide quality service. But it also is a missed opportunity to be able to hear how you can better serve the people in your community.
And I think if I can just add very quick, I echo everything that Portia, Talonda, and Cheryl just said, but also be aware of, implicit bias and how that is affecting the way you serve underserved communities, and especially Black and women of color in Chester County. So like they said, I think they said it all, but just making sure that it's not just you taking a training because it's required by your job, but you really have to pay attention of how this training can help you to support these families.
Fantastic. So we have time for one more question, and this is from Anonymous. Thank you so much for sharing the stories. I would like to ask what some assumptions you have about the United States, about why the United States is doing poorly in maternal health and why it hasn't improved, since the concerns have been brought up many times.
I can take a stab at that one. Statistics show that what other countries get right, and that is not happening in the United States, is they have more postpartum help with midwives and doulas and different people who have eyes on women and that close personal relationship. In the United States, our very culture is that, we have very little time off. We may have our little 12 weeks of FMLA. It's not paid. A lot of times we have to get back to work. We have to do what we have to do. And we're not focusing on really putting number one first. Other countries get it right, where they have a period of confinement. What that is they tell mom to go sit down, lay down, rest. We're going to help you take care of the kids, the family, and you get rest. You don't leave the house until at least your lochia has stopped, but we don't do that so well here in the United States. But there is, other countries get that right, where they have more midwives giving the care and more doulas with their mothers.
Thank you so much. Well, we've run out of time. We could certainly continue to talk about this for a long time. And I hope that everyone who's watching, everybody who's participated, that we do just that. We need to continue this conversation and we need to do the work. As Kim mentioned, what I will do is I will send an email after this with contact information for our presenters, so you can certainly get in touch with any of them. And I want to thank, of course, our presenters for being here and for helping us spread the message. And then thank everybody who is watching. I appreciate everybody taking time out of their day for this important issue. And I hope everyone has a great day. Thank you all.